Phlebotomy Anatomy and Physiology Exam Review. Question 1. After reviewing the urine drug screen order, at the morning collection round, Malik is awake and the requisition lists a urine drug screen. Which action best confirms the patient identity before the draw? Option A. Collect the specimen first and verify the chart afterward. Option B. Ask a co-worker if the patient looks familiar. Option C. Use the room number because it matches the schedule. Option D. Ask the patient to state two identifiers and compare them with the requisition and labels. The correct answer is option D. Ask the patient to state two identifiers and compare them with the requisition and labels. Positive identification requires active confirmation with two patient-specific identifiers and comparison with the order and labels. Room numbers can change, visual recognition is unreliable, and verifying after collection increases the risk of a wrong patient specimen. Question 2. During Grace's stat draw, during a stat collection in Bay 7, the wristband and requisition do not match. What should the phlebotomist do first? Option A. Stop the collection and resolve the discrepancy according to facility procedure. Option B. Draw the specimen and write a note on the tube. Option C. Use the patient statement only and ignore the wristband. Option D. Ask another patient nearby to confirm the identity. The correct answer is option A. Stop the collection and resolve the discrepancy according to facility procedure. Identification discrepancies must be corrected before any specimen is collected. Drawing first, relying on one source, or asking another patient creates an avoidable patient safety and specimen integrity risk. Question 3. At exam room 5 during an early morning round, a requisition for Grace is missing the provider name and test priority. Which response is most appropriate? Option A. Choose routine priority because most draws are routine. Option B. Clarify the incomplete requisition before collecting the specimen. Option C. Collect all possible tubes to save time. Option D. Ask the patient which tests are needed. The correct answer is option B. Clarify the incomplete requisition before collecting the specimen. A complete order supports proper collection, timing, tube selection, and result routing. Collecting extra tubes, guessing priority, or asking the patient to select tests can lead to incorrect or unauthorized testing. Question 4. Before a type and screen collection, a type and screen is ordered stat for a patient in the pediatric clinic. What does the stat priority mean? Option A. The draw should be cancelled if the patient is not in bed. Option B. The specimen can wait until the next routine round. Option C. The specimen should be collected and processed immediately. Option D. The patient must be fasting for the test. The correct answer is option C. The specimen should be collected and processed immediately. Stat indicates urgent collection and handling because clinical decisions may depend on rapid results. It does not mean routine timing, fasting status, or automatic cancellation based on location. Question 5. In the medical surgical unit, Miriam says they ate breakfast before a fasting blood culture. What is the best next step? Option A. Collect the specimen and label it as fasting. Option B. Cancel the order without notifying the appropriate staff. Option C. Tell the patient to deny eating so the specimen can be collected. Option D. Follow facility policy by documenting the information and confirming whether collection should proceed. The correct answer is option D. Follow facility policy by documenting the information and confirming whether collection should proceed. Fasting status can affect results, so the information must be handled according to policy and communicated when required. Falsifying fasting status, ignoring the issue, or canceling without proper notification is unsafe and unprofessional. Question 6. For an older adult patient in Suite 12, a patient scheduled for a trough drug level is due for the next dose soon. When is the trough specimen usually collected? Option A, immediately before the next scheduled dose. Option B, at any convenient time during the day. Option C, only after the medication has been stopped for 24 hours. Option D, immediately after the medication is swallowed. The correct answer is option A, immediately before the next scheduled dose. A trough level measures the lowest drug concentration and is usually collected just before the next dose. Drawing after a dose, at a random time, or after stopping therapy can misrepresent the medication level. Question 7. While preparing Fatima for a blood alcohol level, a peak drug level is ordered after medication administration. Which action supports accurate timing? Option A, collect it before the medication is given. Option B, use the ordered collection time and facility protocol for that medication. Option C, skip documentation because peak levels are routine. Option D, collect it whenever the tourniquet is already applied. The correct answer is option B. Use the ordered collection time and facility protocol for that medication. Peak timing depends on the medication and must follow the order and facility protocol. Drawing before the dose, collecting randomly, or failing to document timing can make the result clinically misleading. Question 8. During a blood donor center collection, which tube should be drawn first when collecting several venous specimens including blood cultures? Option A, green heparin tube. Option B, gray fluoride tube. Option C, blood culture bottles or sterile blood culture tube. Option D, lavender EDTA tube. The correct answer is option C. Blood culture bottles or sterile blood culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA, fluoride, and heparin tubes contain additives and are collected later in the venous order of draw. Question 9. During Miriam's preoperative draw, a venipuncture requires blood cultures, a light blue coagulation tube, a serum tube, a green tube, a lavender tube, and a gray tube. Which order is correct? Option A, light blue, lavender, green, gray, serum, blood culture. Option B, lavender, green, gray, serum, light blue, blood culture. Option C, serum, gray, lavender, blood culture, green, light blue. Option D, blood culture, light blue, serum, green, lavender, gray. The correct answer is option D. Blood culture, light blue, serum, green, lavender, gray. The venous order of draw reduces additive carryover, cultures first, citrate, serum, heparin, EDTA, then glycolytic inhibitor. The other sequences place additive tubes too early or delay sterile blood cultures, which can compromise results. Question 10. During Grace's early morning draw, why is the order of draw important during venipuncture? Option A. It helps prevent cross-contamination from tube additives. Option B. It eliminates the need to identify the patient. Option C. It prevents every possible hemolyzed specimen. Option D. It makes all tubes fill at the same speed. The correct answer is option A. It helps prevent cross-contamination from tube additives. Order of draw is used to reduce carryover of additives that can alter laboratory results. It does not control fill speed, replace patient identification, or prevent all causes of hemolysis. Question 11. At draw chair 2 during a stat round, a light blue top tube for lactate level is underfilled. Why is this a problem? Option A. The glucose level will be falsely preserved. Option B. The blood to anticoagulant ratio will be incorrect for coagulation testing. Option C. The specimen will automatically convert to serum. Option D. The tube will become sterile after centrifugation. The correct answer is option B. The blood to anticoagulant ratio will be incorrect for coagulation testing. Sodium citrate tubes require a proper fill volume to maintain the correct blood-to-additive ratio for coagulation tests. Centrifugation does not fix the ratio, serum is not produced from an anticoagulated tube, and glucose preservation is associated with gray tubes. Question 12. Before a urine drug screen collection, which additive is commonly found in a light blue top coagulation tube? Option A, lithium heparin. Option B, sodium fluoride and potassium oxalate. Option C, sodium citrate. Option D, EDTA. The correct answer is option C. Sodium citrate. Sodium citrate is used for many coagulation studies because it binds calcium in a controlled, reversible way. EDTA is used mainly for hematology, heparin is used for many plasma chemistry tests, and fluoride oxalate is used for glucose-related testing. Question 13. In the urgent care unit, which tube is typically selected for a CBC? Option A, red serum tube only. Option B, gray fluoride oxalate tube. Option C, light blue sodium citrate tube. Option D, lavender top EDTA tube. The correct answer is option D. Lavender top EDTA tube. EDTA preserves cellular components and is the usual anticoagulant for complete blood count testing. Citrate is used for coagulation, gray tubes help preserve glucose, and a red serum tube does not preserve cells for CBC analysis. Question 14. For an anxious adult patient in room 214, a chemistry test requires plasma and rapid processing. Which tube is commonly appropriate? Option A, green top heparin tube. Option B, light blue sodium citrate tube. Option C, lavender top EDTA tube. Option D, sterile blood culture bottle only. The correct answer is option A. Green top heparin tube. Heparin tubes are commonly used when plasma is needed for many chemistry tests. EDTA can interfere with chemistry analytes, citrate is intended for coagulation, and blood culture bottles are for microbiology. Question 15. While preparing Lucas for a type N screen, which tube additive helps preserve glucose by slowing glycolysis? Option A, sodium citrate only. Option B, sodium fluoride with potassium oxalate. Option C, EDTA only. Option D, clot activator gel only. The correct answer is option B. Sodium fluoride with potassium oxalate. Gray top tubes commonly contain sodium fluoride to inhibit glycolysis and potassium oxalate as an anticoagulant. Citrate supports coagulation testing, EDTA supports hematology, and clot activator tubes are used to obtain serum. Question 16. During a morning collection round collection, a gold top SST is collected for a chemistry panel. What is the main purpose of the gel separator? Option A. It converts plasma into whole blood. Option B. It prevents the need for patient identification. Option C. It forms a barrier between serum and cells after centrifugation. Option D. It sterilizes the specimen during transport. The correct answer is option C. It forms a barrier between serum and cells after centrifugation. The separator gel helps keep serum separated from cells after centrifugation, supporting specimen stability. It does not replace identification, create whole blood, or sterilize a specimen. Question 17. After reviewing the fasting glucose order, after filling a lavender top tube, what should the phlebotomist do? Option A, place the tube upright without mixing. Option B, shake the tube vigorously for 10 seconds. Option C, centrifuge the whole blood immediately for a CBC. Option D, gently invert the tube according to manufacturer instructions. The correct answer is option D. Gently invert the tube according to manufacturer instructions. Gentle inversion mixes blood with EDTA and helps prevent clot formation. Vigorous shaking can hemolyze cells, no mixing can allow clotting, and CBC specimens are not centrifuged before hematology analysis. Question 18. During Elena's fasting draw, a lavender tube contains visible clots before CBC testing. What is the likely result? Option A. The specimen may be rejected because cell counts can be inaccurate. Option B. The specimen becomes ideal for coagulation testing. Option C. The clot improves platelet accuracy. Option D. The tube color no longer matters. The correct answer is option A. The specimen may be rejected because cell counts can be inaccurate. Clots trap cells and can make hematology results inaccurate, so recollection may be required. Clotting does not improve platelet counts, does not make the specimen suitable for coagulation, and does not remove tube requirements. Question 19. At triage bay during a routine round, which venipuncture site is usually preferred for routine adult blood collection? Option A. Vein on the side with a dialysis fistula. Option B. Median cubital vein. Option C. Basilic vein as the first choice. Option D. Artery in the wrist. The correct answer is option B. Median cubital vein. The median cubital vein is commonly preferred because it is often well anchored and less close to major nerves and arteries. The basilic vein requires more caution. Arteries are not used for routine venipuncture by phlebotomists, and fistula arms should be avoided. Question 20. Before a type and screen collection, why is the basilic vein generally used with more caution than the median cubital vein? Option A. It cannot be palpated through the skin. Option B. It contains EDTA from previous draws. Option C. It lies closer to nerves and the brachial artery. Option D. It always contains arterial blood. The correct answer is option C. It lies closer to nerves and the brachial artery. The basilic vein is near structures that increase the risk of nerve or arterial injury if technique is poor. It is still a vein, it may be palpable, and tube additives do not remain in veins from earlier collections. Question 21. For a teenage patient in collection station 4, a patient has a dialysis fistula in the left arm. Which choice is safest for routine venipuncture? Option A. Use the fistula arm because it has larger vessels. Option B. Place the tourniquet tightly over the fistula. Option C. Draw directly from the fistula to obtain faster flow. Option D. Use another acceptable site and follow facility policy. The correct answer is option D. Use another acceptable site and follow facility policy. A fistula arm is generally avoided because damage can threaten dialysis access and patient safety. Drawing from it, applying tourniquet pressure over it, or choosing it for convenience is inappropriate without specific authorization. Question 22. For a geriatric patient in exam room 5, the only visible vein is above an active 4 line. What should the phlebotomist do first? Option A. Look for an acceptable site on the opposite arm or follow facility policy for 4 situations. Option B. Draw directly above the 4 without documentation. Option C. Collect from the 4 tubing into all tubes. Option D. Ignore the 4 because tube additives prevent contamination. The correct answer is option A. Look for an acceptable site on the opposite arm or follow facility policy for 4 situations. Specimens should be collected away from active 4 infusions when possible because fluid contamination can alter results. Drawing above the 4, collecting from tubing without authorization, or relying on additives does not protect specimen integrity. Question 23. While preparing Hannah for a ammonia level, a large bruise is present over the intended venipuncture site. Which action is best? Option A. Apply the tourniquet for several minutes to clear the bruise. Option B. Select a different acceptable site. Option C. Draw through the bruise because blood flow is easier. Option D. Massage the bruise firmly before inserting the needle. The correct answer is option B. Select a different acceptable site. Bruised or hematoma areas should be avoided because the specimen may be contaminated with tissue fluid and the patient may be injured further. Drawing through it, massaging it, or prolonged tourniquet use can worsen the problem. Question 24. After reviewing the basic metabolic panel order, a patient has edema at the proposed puncture site. Why should that site usually be avoided? Option A: edema always makes veins arterial. Option B: edema sterilizes the skin surface. Option C: tissue fluid can contaminate the specimen and make collection unreliable. Option D: edema guarantees a faster tube fill. The correct answer is option C. Tissue fluid can contaminate the specimen and make collection unreliable. Edematous tissue contains excess fluid that can dilute or contaminate the specimen and makes vein assessment harder. It does not change veins into arteries, sterilize skin, or guarantee good blood flow. Question 25. After reviewing the glucose test order, what is the usual angle for needle insertion during routine antecubital venipuncture? Option A: any angle if the tourniquet is tight enough. Option B: about 90 degrees with the bevel down. Option C: parallel to the skin with the bevel down. Option D: about 15 to 30 degrees with the bevel up. The correct answer is option D. About 15 to 30 degrees with the bevel up. A 15 to 30 degree angle with the bevel up supports safe entry into the vein. A steep angle, bevel down insertion, or relying on tourniquet tightness increases the risk of pain, missed veins, or injury. Question 26. During Hannah's weekend draw, how should the vein be anchored before inserting the needle? Option A: pull the skin taut below the puncture site. Option B: hold the needle cap against the vein. Option C: press directly over the cleaned puncture site. Option D: ask the patient to pump the fist repeatedly. The correct answer is option A. Pull the skin taut below the puncture site. Anchoring below the site stabilizes the vein and helps prevent rolling. Touching the cleaned site can contaminate it, using the cap is unsafe, and repeated fist pumping can contribute to hemoconcentration. Question 27. At draw chair 2 during a routine round, after cleaning a venipuncture site with alcohol, when should the needle be inserted? Option A: after wiping the site dry with a used gauze pad. Option B: after the alcohol has air dried completely. Option C: immediately while the site is still wet. Option D: only after blowing on the site to speed drying. The correct answer is option B. After the alcohol has air dried completely. Allowing alcohol to air dry supports antisepsis and reduces stinging or hemolysis risk. Inserting through wet alcohol, wiping with used gauze, or blowing on the site can compromise technique. Question 28. For a dehydrated adult patient in Bay 3, a phlebotomist palpates the vein again after antisepsis with an unclean finger. What should happen before puncture? Option A: the draw should continue because palpation improves flow. Option B: the patient should wipe the site with clothing. Option C: the site should be cleaned again according to procedure. Option D: the tourniquet should be tightened to remove contamination. The correct answer is option C. The site should be cleaned again according to procedure. Retouching the prepared site can contaminate it, so the site must be recleaned unless sterile technique permits otherwise. Continuing, using clothing, or tightening a tourniquet does not restore aseptic preparation. Question 29. In the urgent care unit, for most routine venipunctures, how long should the tourniquet remain on? Option A: as long as the patient can tolerate discomfort. Option B: at least 5 minutes for accurate chemistry results. Option C: until all tubes have been labeled at the desk. Option D: no longer than about 1 minute when possible. The correct answer is option D. No longer than about 1 minute when possible. Prolonged tourniquet application can cause hemoconcentration and alter some results. Leaving it on for several minutes, delaying removal until desk labeling, or using discomfort as the limit is not appropriate. Question 30. For a pediatric patient in Suite 12, why should patients avoid repeated fist pumping during venipuncture? Option A. It can contribute to hemoconcentration and affect some analytes. Option B. It sterilizes the puncture site. Option C. It prevents all veins from becoming visible. Option D. It replaces the need for tube inversion. The correct answer is option A. It can contribute to hemoconcentration and affect some analytes. Repeated fist pumping can alter specimen composition, including some chemistry values. It does not sterilize the site, replace mixing, or reliably improve every collection. Question 31. While preparing Nora for a ammonia level, a patient reports sharp, electric pain radiating down the arm during needle insertion. What should the phlebotomist do? Option A. Rotate the needle several times to redirect it. Option B. Stop the draw and remove the needle safely. Option C. Advance the needle deeper to finish faster. Option D. Ask the patient to ignore it until all tubes are filled. The correct answer is option B. Stop the draw and remove the needle safely. Radiating electric pain can indicate nerve contact, so the draw should be stopped to prevent injury. Advancing, ignoring the pain, or rotating the needle can worsen tissue or nerve damage. Question 32. During a pediatric clinic collection, a swelling begins to form around the puncture site while the tube is filling. What is the best response? Option A. Continue collecting because swelling means the vein is full. Option B. Apply heat and keep drawing through the swelling. Option C. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Option D. Ask the patient to bend the elbow tightly over the needle. The correct answer is option C. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Swelling suggests a hematoma or infiltration, so the draw should be discontinued and pressure applied. Continuing, applying heat during the draw, or bending the elbow can increase bleeding and bruising. Question 33. After reviewing the hemoglobin and hematocrit order, a patient becomes pale and sweaty during collection. Which immediate action is safest? Option A. Give the patient food without checking policy or status. Option B. Finish all tubes before responding. Option C. Tell the patient to stand and walk it off. Option D. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. The correct answer is option D. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. Pale skin and sweating can signal syncope, so patient safety and stopping the procedure come first. Standing, finishing the draw, or giving food without assessment can create additional risk. Question 34. During Lucas's evening draw, bright red blood pulses rapidly into the collection device during an attempted venipuncture. What should the phlebotomist suspect? Option A. Possible arterial puncture. Option B. Improper tube inversion only. Option C. Normal venous flow from a small vein. Option D. A clotted EDTA specimen. The correct answer is option A. Possible arterial puncture. Pulsing bright red blood suggests arterial involvement and requires immediate response according to policy. Small vein venous flow is usually darker and non-pulsatile, while clotted EDTA and tube inversion issues occur after collection. Question 35. At room 214 during a routine round, if an accidental arterial puncture is suspected, what should the phlebotomist do? Option A. Ignore it if the patient says there is no pain. Option B. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. Option C. Apply a loose bandage only and send the patient home. Option D. Collect additional tubes quickly before the artery collapses. The correct answer is option B. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. Suspected arterial puncture requires stopping the procedure and applying firm pressure to reduce bleeding risk. Continuing, using only a loose bandage, or ignoring the event can lead to serious complications. Question 36. In the urgent care unit, a patient has petechiae after tourniquet application. What do petechiae suggest? Option A. The site is fully sterilized. Option B. The patient has no risk of bruising. Option C. Small capillaries may be fragile or bleeding under the skin. Option D. The needle gauge is too large in every case. The correct answer is option C. Small capillaries may be fragile or bleeding under the skin. Petechiae are small pinpoint hemorrhages that can suggest capillary fragility or increased bleeding tendency. They do not indicate sterility, absence of bruising risk, or automatically prove the needle gauge is wrong. Question 37. In the medical surgical unit, which step should occur before removing the needle from the vein? Option A. Label the specimen at a separate workstation first. Option B. Ask the patient to bend the elbow tightly. Option C. Activate the needle safety device while the needle is still in the vein if not designed for that. Option D. Release the tourniquet and remove the last tube. The correct answer is option D. Release the tourniquet and remove the last tube. The tourniquet is released and the tube removed before needle withdrawal to reduce bleeding and pressure. Bending the elbow, misusing safety devices, or delaying bedside labeling can create patient care or specimen identification problems. Question 38. For a geriatric patient in room 214, after needle removal, what is the best way to help prevent bruising? Option A. Apply direct pressure with clean gauze until bleeding stops. Option B. Tell the patient to rub the site vigorously. Option C. Leave immediately without checking the site. Option D. Have the patient bend the arm tightly upward. The correct answer is option A. Apply direct pressure with clean gauze until bleeding stops. Direct pressure helps stop bleeding and reduces hematoma formation. Rubbing, bending the arm tightly, or failing to check the site can worsen bruising or miss continued bleeding. Question 39. While preparing OMAR for a patient NINR, a patient reports an allergy to adhesive bandages. Which response is best? Option A. Use tape directly over wet blood. Option B. Use an appropriate alternative dressing according to policy. Option C. Skip pressure and send the patient away. Option D. Apply the standard bandage because allergies are rare. The correct answer is option B. Use an appropriate alternative dressing according to policy. Patient allergies should guide selection of bandaging materials while still maintaining hemostasis. Ignoring the allergy, skipping pressure, or taping over active bleeding is unsafe. Question 40. During a blood donor center collection, which device is often helpful for a patient with small, fragile veins? Option A. Broken evacuated tube holder. Option B. Large bore needle chosen only for speed. Option C. Winged infusion set with an appropriate small gauge needle. Option D. Used needle with the cap replaced. The correct answer is option C. Winged infusion set with an appropriate small gauge needle. A winged collection set can offer better control for small or fragile veins when used correctly. Large needles may damage fragile veins, defective equipment must not be used, and used needles should never be reused or recapped. Question 41. After reviewing the ammonia level order, why might a syringe be selected instead of a standard evacuated tube system for a fragile vein? Option A. It makes patient identification unnecessary. Option B. It eliminates the order of draw. Option C. It removes the need for a transfer device. Option D. It may allow gentler control of suction during collection. The correct answer is option D. It may allow gentler control of suction during collection. A syringe can allow the collector to control suction more gently in selected difficult draws. It does not remove order of draw requirements, should be transferred with a safety transfer device, and never replaces patient identification. Question 42. During Amina's follow-up draw, when transferring blood from a syringe to evacuated tubes, which method is safest? Option A. Use an approved blood transfer device. Option B. Push blood through the needle into the tube stopper. Option C. Use the same needle to transfer blood after recapping it. Option D. Remove tube stoppers and pour blood into each tube. The correct answer is option A. Use an approved blood transfer device. A transfer device reduces Sharp's risk and helps preserve specimen quality. Pushing through a needle, removing stoppers, or recapping increases exposure risk and can cause hemolysis or contamination. Question 43. At Bay 7 during an afternoon round, which action most increases the risk of hemolysis? Option A. Using the correct needle angle. Option B. Shaking tubes vigorously after collection. Option C. Allowing alcohol to air dry. Option D. Gently inverting additive tubes as directed. The correct answer is option B. Shaking tubes vigorously after collection. Vigorous shaking can rupture red blood cells and produce hemolysis. Gentle inversion, air drying antiseptic, and proper insertion technique support specimen quality rather than damaging cells. Question 44. Before a blood alcohol level collection, a serum potassium result is unexpectedly high, and the specimen is visibly hemolyzed. How can hemolysis affect potassium? Option A. It changes potassium into glucose. Option B. It proves the patient has no electrolyte problem. Option C. It can falsely increase potassium by releasing intracellular potassium from red cells. Option D. It always lowers potassium to zero. The correct answer is option C. It can falsely increase potassium by releasing intracellular potassium from red cells. Red cells contain potassium, so hemolysis can falsely elevate measured potassium. It does not always lower potassium, rule out disease, or transform potassium into another analyte. Question 45. In the pediatric clinic, which practice helps prevent pre-analytical errors? Option A. Carry unlabeled tubes to the desk and label later. Option B. Pre-label several tubes before locating patients. Option C. Use only room numbers on specimens. Option D. Label specimens at the patient side immediately after collection. The correct answer is option D. Label specimens at the patient side immediately after collection. Bedside labeling connects the specimen to the correct patient at the time of collection. Pre-labeling, delayed labeling, and room number only identification increase wrong patient and mislabeling risk. Question 46. For an adult patient in Bay 3, which information is typically required on a properly labeled blood specimen? Option A. Patient identifiers plus collection date, time, and collector identification as required by policy. Option B. Only the phlebotomist first name. Option C. Only the test abbreviation without patient identity. Option D. Only the room number and bed color. The correct answer is option A. Patient identifiers plus collection date, time, and collector identification as required by policy. Labels must support positive specimen identification and traceability through collection details. Room numbers, collector name alone, or test abbreviations without patient identifiers are insufficient. Question 47. While preparing Jordan for a blood culture, a phlebotomist realizes a tube was labeled with the wrong patient name after leaving the room. What is the safest action? Option A. Use correction fluid on the label. Option B. Follow policy for specimen rejection and recollection if needed. Option C. Scratch out the name and write another one. Option D. Send it to the lab because the tube color is correct. The correct answer is option B. Follow policy for specimen rejection and recollection if needed. Mislabeling is a serious patient safety issue and must be handled by policy, often requiring recollection. Altering labels or sending a known mislabeled specimen can lead to harmful treatment decisions. Question 48. During a hospital laboratory collection, which example is a pre-analytical error? Option A. Provider interpreting a completed report. Option B. Billing department mailing a statement. Option C. Collecting a coagulation specimen in an underfilled light blue tube. Option D. Analyzer software calculating a final result. The correct answer is option C. Collecting a coagulation specimen in an underfilled light blue tube. Pre-analytical errors occur before testing, including collection, labeling, handling, and transport problems. Analyzer calculations are analytical, provider interpretation is post-analytical, and billing is not part of specimen collection quality. Question 49. After reviewing the ammonia level order, a specimen for bilirubin testing must be protected from light. Which handling step is appropriate? Option A. Transfer it into a gray top tube after collection. Option B. Shake the specimen to remove light exposure. Option C. Place the specimen in direct sunlight. Option D. Wrap or cover the specimen as required by laboratory protocol. The correct answer is option D. Wrap or cover the specimen as required by laboratory protocol. Light-sensitive specimens should be protected using the method specified by the laboratory. Sunlight, shaking, or transferring to an incorrect tube can compromise specimen integrity. Question 50. During Andre's follow-up draw, a specimen must be chilled and delivered rapidly to the laboratory. What should guide the phlebotomist? Option A. The test-specific handling instructions in the collection manual. Option B. Whether the patient asks for faster service. Option C. Personal preference for all tubes. Option D. The color of the tourniquet. The correct answer is option A. The test-specific handling instructions in the collection manual. Temperature and timing requirements are test-specific and should follow the laboratory collection manual. Patient preference and unrelated equipment color do not determine specimen handling requirements. Question 51. At exam room 5 during a weekend round, why should tubes be inspected before use? Option A. To decide whether patient identification can be skipped. Option B. To check for cracks, contamination, expiration, or vacuum problems. Option C. To make expired tubes acceptable. Option D. To remove the need for order of draw. The correct answer is option B. To check for cracks, contamination, expiration, or vacuum problems. Equipment inspection helps prevent collection failure and specimen quality problems. It does not replace identification, revive expired supplies, or eliminate the order of draw. Question 52. Before a blood culture collection, a tube has passed its expiration date. What should the phlebotomist do? Option A. Fill it halfway to compensate for expiration. Option B. Use it only for pediatric patients. Option C. Do not use the tube and obtain an acceptable replacement. Option D. Use it if the stopper color looks normal. The correct answer is option C. Do not use the tube and obtain an acceptable replacement. Expired tubes may have reduced vacuum or compromised additives, so they should not be used. Appearance, patient age, or partial filling does not make an expired tube acceptable. Question 53. In the oncology clinic, before a capillary puncture, why is the site often warmed? Option A. To replace the need for patient identification. Option B. To make the lancet reusable. Option C. To sterilize the site without antiseptic. Option D. To increase blood flow to the puncture area. The correct answer is option D. To increase blood flow to the puncture area. Warming can improve capillary blood flow and reduce excessive squeezing. It does not sterilize the site, replace identity checks, or permit reuse of single-use devices. Question 54. For a teenage patient in Suite 12, for an infant heel puncture, which area is generally safest? Option A, medial or lateral plantar surface of the heel. Option B, center of the heel over the calcaneus. Option C, arch of the foot. Option D, posterior curvature of the heel. The correct answer is option A. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel reduces the risk of bone injury when performed correctly. The posterior curvature, center heel, and arch increase the chance of injury or poor specimen collection. Question 55. While preparing Lena for a ammonia level, why should the first drop of blood from a routine capillary puncture usually be wiped away? Option A. It always contains only plasma. Option B. It may contain tissue fluid or debris that can affect the specimen. Option C. It is required for blood culture bottles. Option D. It prevents all needle stick injuries. The correct answer is option B. It may contain tissue fluid or debris that can affect the specimen. The first drop can be contaminated with tissue fluid or skin debris, so wiping it away supports specimen quality. It is not pure plasma, is not used for blood culture bottles, and does not address sharp safety by itself. Question 56. During a hospital laboratory collection, which capillary collection order is commonly used when blood gases are not collected? Option A, serum first, then EDTA, then other additives. Option B. Any order because capillary tubes have no additives. Option C, EDTA specimens first, then other additive specimens, then serum specimens. Option D, gray first for every patient, then culture bottles. The correct answer is option C. EDTA specimens first, then other additive specimens, then serum specimens. Capillary order differs from venous order and commonly places EDTA early to reduce clotting in small volume samples. Serum first collection, universal gray first collection, or ignoring additives can compromise results. Question 57. During Kai's follow-up draw, during a finger stick, why should the finger not be squeezed forcefully? Option A. It changes venous blood into arterial blood. Option B. It removes the need to wipe the first drop. Option C. It makes the specimen sterile. Option D, excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. Excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. Milking or squeezing too hard can damage cells and introduce tissue fluid, affecting test accuracy. It does not sterilize blood, transform blood type, or replace correct capillary technique. Question 58. During Daniel's preoperative draw, which finger is generally avoided for adult capillary puncture? Option A. The thumb or index finger. Option B. The ring finger. Option C. A warm finger with good circulation. Option D. The middle finger. The correct answer is option A. The thumb or index finger. The thumb and index finger are often avoided because they may be more calloused, sensitive, or frequently used. The middle and ring fingers are commonly preferred when suitable, and warming may improve flow. Question 59. At exam room 5 during a midday round, a used lancet remains on the tray after a dermal puncture. What should be done? Option A, place it in regular trash if the cap is on. Option B, discard it immediately into an approved sharps container. Option C, save it for the next patient if it looks clean. Option D, hand it to the patient to throw away later. The correct answer is option B. Discard it immediately into an approved sharps container. Used sharps must be disposed of promptly in an approved sharps container. Regular trash, reuse, or asking the patient to handle the device creates exposure risk. Question 60. Before a CBC collection, which statement best describes standard precautions? Option A. They replace the need for hand hygiene. Option B. They are optional for routine outpatient draws. Option C. They apply to the care of every patient regardless of known infection status. Option D. They apply only to patients with confirmed HIV. The correct answer is option C. They apply to the care of every patient regardless of known infection status. Standard precautions treat blood and certain body fluids as potentially infectious for all patients. Limiting them to known infections, treating them as optional, or skipping hand hygiene defeats their purpose. Question 61. For an adult patient in collection station 4, when should hand hygiene be performed during routine phlebotomy? Option A. Only when gloves visibly tear. Option B. Only at the start of the workday. Option C. Only after collecting blood cultures. Option D. Before patient contact and after glove removal as part of standard practice. The correct answer is option D. Before patient contact and after glove removal as part of standard practice. Hand hygiene before patient contact and after glove removal reduces transmission risk. Waiting for visible tears, limiting hygiene to the start of the day, or applying it only to blood cultures is inadequate. Question 62. For an anxious adult patient in Suite 12, which personal protective equipment is routinely worn for venipuncture when blood exposure is anticipated? Option A, gloves. Option B, sterile surgical gown for every draw. Option C, reusable cloth gloves from home. Option D. No PPE if the patient looks healthy. The correct answer is option A. Gloves. Gloves are routine PPE for blood collection because contact with blood is reasonably anticipated. A sterile gown is not required for every routine draw, healthy appearance does not eliminate risk, and personal cloth gloves are not appropriate medical PPE. Question 63. While preparing Miriam for a blood culture, a blood splash risk is expected during specimen handling. Which PPE may be needed in addition to gloves? Option A, open-toed shoes for ventilation. Option B, eye or face protection according to exposure risk. Option C. A patient wristband. Option D. No additional protection because tubes are closed. The correct answer is option B. Eye or face protection according to exposure risk. Eye or face protection is used when splashes or sprays may expose mucous membranes. Open-toed shoes are unsafe, wristbands identify patients rather than protect staff, and closed tubes do not remove every splash risk. Question 64. During an oncology clinic collection, after a needle stick injury, what is the immediate first aid response? Option A, keep working until the shift ends. Option B, squeeze the wound aggressively for several minutes. Option C, wash the area with soap and water and report the exposure promptly. Option D, apply a tourniquet above the injury and ignore reporting. The correct answer is option C. Wash the area with soap and water and report the exposure promptly. A sharps injury requires immediate cleaning, reporting, and follow-up according to exposure control policy. Delaying care, aggressively squeezing, or failing to report can increase health and documentation risks. Question 65. After reviewing the hemoglobin and hematocrit order, what should happen to a safety needle after venipuncture? Option A, place it on the tray for later disposal. Option B. Recap the needle with 2 hands. Option C. Break the needle off by hand before disposal. Option D. Activate the safety feature and discard the device in a sharps container. The correct answer is option D. Activate the safety feature and discard the device in a sharps container. Safety features and immediate sharps disposal reduce needle stick risk. Two-handed recapping, delayed disposal, and manually breaking needles are unsafe practices. Question 66. During Andre's follow-up draw, a sharps container is filled past the marked fill line. What should the phlebotomist do? Option A. Use an approved container that is not overfilled and follow replacement procedure. Option B. Move sharps into a plastic trash bag. Option C. Push the contents down by hand. Option D. Continue using it until the lid will not close. The correct answer is option A. Use an approved container that is not overfilled and follow replacement procedure. Overfilled sharps containers increase injury risk and should be replaced according to policy. Pushing sharps down, overusing the container, or transferring sharps to trash is unsafe. Question 67. At Bay 7 during a follow-up round, a small blood spill occurs on the collection chair. Which action is appropriate? Option A. Cover it with a clean drape and keep collecting. Option B. Wear appropriate PPE and clean with an approved disinfectant according to policy. Option C. Wipe it with a dry paper towel only. Option D. Ask the next patient to avoid the spot. The correct answer is option B. Wear appropriate PPE and clean with an approved disinfectant according to policy. Blood spills require PPE and proper disinfection to reduce exposure and contamination. Dry wiping alone, ignoring the spill, or covering it without cleaning does not meet infection control expectations. Question 68. Before a therapeutic drug level collection, which practice supports OSHA bloodborne pathogen safety? Option A. Eating at the specimen processing bench. Option B. Recapping every needle after use. Option C. Using engineering controls such as safety engineered sharps devices. Option D. Storing clean tubes inside a sharps container. The correct answer is option C. Using engineering controls such as safety engineered sharps devices. Safety engineered devices are engineering controls that help reduce occupational exposure. Recapping, eating in specimen areas, and storing supplies in sharps containers create avoidable hazards. Question 69. In the outpatient clinic, a patient with suspected airborne infection requires blood collection. What should guide the phlebotomist? Option A. Remove the isolation sign to avoid anxiety. Option B. Use only standard gloves because airborne signs are optional. Option C. Ask the patient to leave isolation for a hallway draw. Option D. Follow the facility transmission-based precaution requirements before entering. The correct answer is option D. Follow the facility transmission-based precaution requirements before entering. Transmission-based precautions add measures based on the route of infection and must be followed. Ignoring isolation, removing signs, or moving the patient unsafely can expose staff and others. Question 70. For a school-age patient in Suite 12, a patient refuses the ordered venipuncture. What should the phlebotomist do? Option A. Respect the refusal and notify the appropriate healthcare professional according to policy. Option B. Draw the specimen quickly before the patient moves. Option C. Ask a family member to hold the patient down. Option D. Threaten the patient with discharge. The correct answer is option A. Respect the refusal and notify the appropriate healthcare professional according to policy. Patients generally have the right to refuse, and the refusal should be communicated and documented according to policy. Forcing, threatening, or restraining without proper authority violates ethical and legal standards. Question 71. While preparing Grace for a bilirubin test, a conscious adult extends an arm after the procedure is explained. What type of consent is most commonly represented? Option A, court-ordered consent. Option B, implied consent. Option C, no consent because the form is electronic. Option D, telephone consent from billing. The correct answer is option B, implied consent. An adult who cooperates after explanation usually demonstrates implied consent for routine venipuncture. Court orders, billing conversations, and electronic forms are different issues and do not describe this interaction. Question 72. During a pediatric clinic collection, a confused patient cannot provide reliable consent for a non-emergency draw. What should the phlebotomist do? Option A, proceed because confusion makes consent unnecessary. Option B, ask another patient in the room to approve. Option C, follow policy for consent through an authorized representative or care team. Option D, collect extra tubes in case consent is later obtained. The correct answer is option C. Follow policy for consent through an authorized representative or care team. When consent is uncertain, policy and authorized decision-making pathways must be followed. Confusion does not eliminate consent requirements, and other patients cannot approve care. Question 73. After reviewing the urine drug screen order, which behavior best protects patient privacy in a busy waiting area? Option A, leave requisitions face up on the counter. Option B, discuss lab results with visitors without permission. Option C, announce diagnoses loudly so patients hear their names. Option D, discuss protected health information only as needed and in an appropriate setting. The correct answer is option D. Discuss protected health information only as needed and in an appropriate setting. Privacy rules require limiting disclosure of protected information to appropriate purposes and settings. Loud announcements, exposed paperwork, and unauthorized discussions can violate confidentiality. Question 74. During Chloe's weekend draw, a patient asks the phlebotomist to explain whether a lab result means cancer. What is the best response? Option A, refer the patient to the provider for interpretation of results. Option B, change the result wording to make it less alarming. Option C, search the internet with the patient and interpret it. Option D, give a diagnosis based on the phlebotomist's opinion. The correct answer is option A. Refer the patient to the provider for interpretation of results. Interpreting diagnoses is outside the phlebotomist's role and should be handled by the provider. Giving opinions, informal internet interpretation, or altering result wording is inappropriate and unsafe. Question 75. At draw chair 2 during a routine round, a patient with limited English proficiency needs instructions for a time test. What is the best communication approach? Option A, speak louder in English until the patient nods. Option B, use an approved interpreter according to facility policy. Option C, use a child family member as the default interpreter. Option D, skip instructions and collect any specimen available. The correct answer is option B. Use an approved interpreter according to facility policy. Approved interpreter services help ensure accurate, respectful communication. Speaking louder, relying on a child by default, or skipping instructions can lead to misunderstanding and poor specimen quality. Question 76. In the blood donor center, which response shows professional communication with an anxious patient? Option A, promise the draw will be painless for everyone. Option B, tell the patient fear is childish. Option C, explain the steps calmly and ask about prior fainting or concerns. Option D, ignore the patient and focus only on tubes. The correct answer is option C. Explain the steps calmly and ask about prior fainting or concerns. Calm explanation and assessment of prior reactions help improve safety and trust. Dismissing fear, ignoring concerns, or promising no pain can damage communication and set unrealistic expectations. Question 77. In the emergency department, a child is scheduled for venipuncture and a parent is present. Which approach is most appropriate? Option A. Hide the needle in a way that prevents consent. Option B. Use complex medical terminology to impress the parent. Option C. Ask the child to sign all legal consent forms alone. Option D. Use age-appropriate explanation and follow policy for guardian involvement. The correct answer is option D. Use age-appropriate explanation and follow policy for guardian involvement. Pediatric collection requires developmentally appropriate communication and correct guardian involvement. Complex jargon, deceptive communication, or relying on a child alone for legal consent is inappropriate. Question 78. For an adult patient in triage bay, a blood culture set is ordered before antibiotics. Which timing is preferred when feasible? Option A. Collect the cultures before antimicrobial therapy begins. Option B. Skip cultures if antibiotics are ordered. Option C. Wait until the antibiotic bag is empty. Option D. Collect only after the fever disappears. The correct answer is option A. Collect the cultures before antimicrobial therapy begins. Blood cultures are ideally collected before antibiotics because therapy can reduce organism recovery. Waiting until after antibiotics, waiting for fever to resolve, or skipping cultures can reduce diagnostic value. Question 79. While preparing amina for a blood culture, for adult blood culture collection, why is adequate volume important? Option A. Any drop of blood is enough for all adult cultures. Option B. Blood volume is a major factor in detecting bloodstream infection. Option C. Volume does not matter if the bottle color is correct. Option D. More volume always prevents contamination. The correct answer is option B. Blood volume is a major factor in detecting bloodstream infection. Adequate blood volume improves the chance of detecting organisms in bloodstream infection. Volume alone does not prevent contamination, bottle color is not enough, and a single drop is inadequate for adult culture protocols. Question 80. After reviewing the fasting glucose order, when collecting 2 adult blood culture sets, which practice helps reduce contamination and improve interpretation? Option A. Draw all bottles from one contaminated site. Option B. Collect after labeling is completed at the desk. Option C. Use separate venipuncture sites when required by protocol. Option D. Pour blood from one bottle into another. The correct answer is option C. Use separate venipuncture sites when required by protocol. Separate sites are commonly used to help distinguish true bloodstream infection from contamination and to meet protocol. Using a contaminated site, transferring between bottles, or delaying proper labeling undermines specimen quality. Question 81. After reviewing the blood alcohol level order, what should be disinfected before inoculating blood culture bottles? Option A. The patient wristband instead of the skin. Option B. The phlebotomist's pen only. Option C. Only the outside of the requisition form. Option D. The bottle septum according to policy. The correct answer is option D. The bottle septum according to policy. Bottle septa are disinfected to reduce contamination when blood is introduced. Cleaning paperwork, wristbands, or pens does not prepare the bottle for specimen collection. Question 82. During Carlos's evening draw, which skin preparation is appropriate for a blood alcohol level collection? Option A. Use a non-alcohol antiseptic according to policy. Option B. Clean the site with drinking alcohol. Option C. Skip all skin antisepsis to avoid contamination. Option D. Use isopropyl alcohol and leave it wet. The correct answer is option A. Use a non-alcohol antiseptic according to policy. Blood alcohol collections generally use a non-alcohol antiseptic to avoid alcohol contamination of the specimen. Using alcohol-based cleaners or skipping antisepsis can compromise either test integrity or infection control. Question 83. At Bay 7 during a preoperative round, A legal blood alcohol specimen requires chain of custody. What is the purpose of chain of custody documentation? Option A. To replace patient identification. Option B. To track specimen handling from collection through testing. Option C. To make a hemolyzed specimen acceptable. Option D. To allow anyone to open the specimen without recording it. The correct answer is option B. To track specimen handling from collection through testing. Chain of custody documents each transfer and helps preserve legal integrity. It does not replace identification, fix specimen quality problems, or permit unrecorded access. Question 84. In the blood donor center, which action supports chain of custody for a drug screen specimen? Option A. Leave the specimen unattended in a public area. Option B. Allow the patient to take the specimen home first. Option C. Seal and document the specimen according to protocol. Option D. Change the collection time later if it is inconvenient. The correct answer is option C. Seal and document the specimen according to protocol. Secure sealing and accurate documentation preserve specimen integrity and traceability. Unattended specimens, patient transport outside protocol, or altered times can invalidate the process. Question 85. In the hospital laboratory, a glucose tolerance test is scheduled. What is important about the baseline specimen? Option A. It is collected only after all timed specimens are complete. Option B. It must always be collected in a blood culture bottle. Option C. It is optional if the patient feels well. Option D. It is collected before the glucose dose is given. The correct answer is option D. It is collected before the glucose dose is given. The baseline specimen provides the starting value before the glucose challenge. Collecting it afterward, treating it as optional, or using a blood culture bottle does not meet glucose tolerance testing requirements. Question 86. For a postoperative adult patient in Bay 7, during a glucose tolerance test, Victor vomits shortly after drinking the glucose solution. What should the phlebotomist do? Option A. Notify the appropriate staff and follow facility protocol. Option B. Ignore it and continue all time draws as usual. Option C. Change the order to a CBC. Option D. Give a second dose without authorization. The correct answer is option A. Notify the appropriate staff and follow facility protocol. Vomiting can invalidate the test or require specific instructions, so the care team and protocol should guide next steps. Ignoring it, reducing without authorization, or changing the order is outside the phlebotomist's role. Question 87. While preparing amina for a hemoglobin and hematocrit, a point-of-care glucose meter is due for quality control. What should the phlebotomist do? Option A. Use the meter until it gives an error message. Option B. Run required controls according to manufacturer and facility policy before patient testing. Option C. Record control results from memory. Option D. Skip controls because the patient is waiting. The correct answer is option B. Run required controls according to manufacturer and facility policy before patient testing. POC testing requires quality control to verify reliable performance before reporting patient results. Waiting for errors, skipping controls, or fabricating records undermines patient safety and compliance. Question 88. During a blood donor center collection, a point-of-care result is outside the critical range. What is the appropriate response? Option A. Hide the result until the patient leaves. Option B. Change the result to the nearest normal value. Option C. Report and document the result according to critical value policy. Option D. Repeat it endlessly without notifying anyone. The correct answer is option C. Report and document the result according to critical value policy. Critical results require prompt communication and documentation under facility policy. hiding, altering, or endlessly repeating without notification can delay urgent care. Question 89. During Elena's routine draw, what does CLIA wave testing mean in a phlebotomy setting? Option A, testing that is never documented. Option B, testing that can be performed without training. Option C, testing that needs no quality control ever. Option D, testing that is categorized as simple with low risk when performed correctly under requirements. The correct answer is option D. Testing that is categorized as simple with low risk when performed correctly under requirements. CLIA wave tests are considered simple and low risk when performed as directed, but requirements still apply. Quality control, training, and documentation remain important for safe point-of-care testing. Question 90. During Omar's fasting draw, which step is required before centrifuging specimens? Option A, balance the centrifuge with tubes of similar volume. Option B, open all tube stoppers during spinning. Option C, place one tube alone for faster spinning. Option D, spin cracked tubes to test whether they leak. The correct answer is option A. Balance the centrifuge with tubes of similar volume. Balancing the centrifuge helps prevent equipment damage, tube breakage, and safety hazards. Spinning a single tube, opening tubes, or using cracked tubes is unsafe. Question 91. At triage bay during a midday round, why must many serum specimens clot before centrifugation? Option A, clotting sterilizes every specimen. Option B, incomplete clotting can leave fibrin and affect separation. Option C, clotting is only needed for urine specimens. Option D, clotting turns serum into EDTA plasma. The correct answer is option B. Incomplete clotting can leave fibrin and affect separation. Allowing serum tubes to clot properly helps produce clean serum after centrifugation. Clotting does not create EDTA plasma, sterilize specimens, or apply only to urine. Question 92. For a school-age patient in bed 18, what is plasma? Option A. Only red blood cells after centrifugation. Option B. The solid clot from a serum tube. Option C. The liquid portion of anticoagulated blood after cells are separated. Option D. A disinfectant used for venipuncture. The correct answer is option C. The liquid portion of anticoagulated blood after cells are separated. Plasma is the liquid component from blood collected with anticoagulant and separated from cells. A clot, red cells alone, and disinfectant are different concepts. Question 93. In the morning collection round, what is serum? Option A, whole blood mixed with EDTA. Option B. The anticoagulant inside a gray tube. Option C. The buffy coat only. Option D. The liquid portion of blood after clotting and centrifugation. The correct answer is option D. The liquid portion of blood after clotting and centrifugation. Serum is liquid separated from clotted blood and lacks clotting factors consumed in clot formation. EDTA whole blood, gray tube additive, and the buffy coat are not serum. Question 94. For a dehydrated adult patient in bed 18, which blood component is mainly responsible for oxygen transport? Option A, red blood cells. Option B, plasma water only. Option C, clot activator gel. Option D, platelets. The correct answer is option A. Red blood cells. Red blood cells contain hemoglobin, which transports oxygen. Platelets support clotting, plasma water carries dissolved substances, and gel is a tube component rather than a blood cell. Question 95. While preparing tera for a hemoglobin and hematocrit, which blood component is most directly involved in primary hemostasis? Option A, serum separator gel. Option B, platelets. Option C, sodium fluoride. Option D, tourniquet latex. The correct answer is option B. Platelets. Platelets help form the initial plug at a site of vascular injury. Sodium fluoride, latex, and separator gel are collection-related materials rather than blood components responsible for primary hemostasis. Question 96. During an emergency department collection, what is the function of white blood cells? Option A. They act as clot activator gel. Option B. They provide tube vacuum. Option C. They help defend the body against infection. Option D. They prevent every specimen from hemolyzing. The correct answer is option C. They help defend the body against infection. White blood cells are part of immune defense and inflammatory responses. They do not create tube vacuum, act as gel, or prevent all hemolysis. Question 97. After reviewing the CBC order, which term means stopping bleeding? Option A. Hemoconcentration. Option B. Hemolysis. Option C. Hematoma. Option D. Hemostasis. The correct answer is option D. Hemostasis. Hemostasis is the process that stops bleeding through vessel response, platelet action, and coagulation. Hemolysis is red cell rupture, a hematoma is a blood collection in tissue, and hemoconcentration is concentration of blood components. Question 98. During Bryan's routine draw, which term describes rupture of red blood cells in a specimen? Option A. Hemolysis. Option B. Hemostasis. Option C. Phlebitis. Option D. Syncope. The correct answer is option A. Hemolysis. Hemolysis means red blood cells have ruptured, releasing intracellular contents into the specimen. Hemostasis stops bleeding, syncope is fainting, and phlebitis is vein inflammation. Question 99. At bed 18 during a routine round, which term describes fainting during or after blood collection? Option A. Edema. Option B. Syncope. Option C. Aliquoting. Option D. Petechiae. The correct answer is option B. Syncope. Syncope is fainting and can occur with anxiety, pain, or vasovagal response during phlebotomy. Edema is swelling, petechiae are pinpoint hemorrhages, and aliquoting is transferring a specimen portion. Question 100. Before a therapeutic drug level collection, what does hematoma mean in phlebotomy? Option A. The tube additive has expired. Option B. The specimen has been centrifuged correctly. Option C. Blood has accumulated in the tissue around the puncture site. Option D. The patient has completed informed consent. The correct answer is option C. Blood has accumulated in the tissue around the puncture site. A hematoma is a localized collection of blood in tissue and may appear as swelling or bruising. It is not a processing step, expiration issue, or consent status.